Hello, I'm Catherine Backman, Senior Scientist at Arthritis Research Canada and Professor of Occupational Science and Occupational Therapy at the University of British Columbia. Let me share with you how our research is adapting to the COVID-19 pandemic. Rarely has the whole world been talking about occupation, about doing things differently and doing instead. The pandemic has disrupted activities and routines on a grand scale, with social media, news outlets, and friends and family sharing advice on how to stay healthy while staying at home. We're adapting and adding a component to a current study to research the effects of self-isolation and staying home. My PhD student, Flora Tormiles, wanted to learn more about the kinds of occupations and activities people with and without inflammatory arthritis do in their day-to-day lives, and how those activities contribute to the self-reported health status and physiological health marker gathered from blood tests. We already have baseline data from 143 people, so we know what everyday activity looks like for them well before the COVID-19 pandemic began to interrupt daily life. So we're well positioned to ask the question, how has the pandemic affected daily life for adults with and without inflammatory arthritis? We adapted the activity and health assessments from that study so that they can be completed online. We hope participants will complete this extra survey now during the stay-at-home advisory period, and again once health officials reopen businesses and community facilities. Then we'll be able to map the impact of the pandemic on what people do, how they manage the lockdown, and whether or not the experience is any different for people with inflammatory arthritis compared to those without arthritis. With a better understanding of how arthritis and social isolation affect the things we need and want to do, our research will help improve arthritis self-management strategies, rehabilitation services, and public health recommendations, so people with arthritis can continue to do the occupations and activities that structure their days and sustain their health and well-being.